The golden retriever lay down beside the newborn before anyone asked her to. She stayed for 11 days. On the 12th day, they finally understood why. The baby came home on a Friday in February. Clara Espinosa, 7 days old, 3 pounds 14 ounces, had been in the NICU for the first week of her life. She had been born 6 weeks early, small and breathing and fighting in the way that premature babies fight, which is quietly, with enormous effort, and without drama. She was cleared for home on a clinical basis that her father, Santiago, found both reassuring and terrifying in equal measure. Rue was a 5-year-old golden retriever who had lived with Santiago and his wife Elena since before their wedding. She had been gentle, reliable, the dog that every visitor described as the calmest animal they had ever encountered. She had prepared, as best a dog can prepare, for the baby who was coming. New smells in the house, a new room at the end of the hallway, a new collection of objects that had arrived in crinkly bags. She had been unhurried about all of it. She was an unhurried animal. When Santiago carried Clara through the front door, Rue met them in the entryway and stood very still. She did not jump. She did not crowd. She lowered her nose in the direction of the blanket and inhaled once, long and deliberate. And then she sat. They let her sniff the edge of the blanket. She did it again. Santiago watched her. Elena stood behind him, hands not quite at rest. They put Clara in the bassinet in the nursery. Rue sat outside the nursery door. She was there when they woke in the night for the 2 a.m. feeding. She was there when Elena came back from the kitchen with a glass of water. She was there when Santiago walked past at 4:30 to check the monitor. He looked at her through the dark of the hallway, and she looked back, and neither of them did anything. On the second morning, Rue was in the nursery. No one had let her in. The door was ajar. They had not been careful about it, and she had entered at some point in the early morning and was lying on the rug beside the bassinet, length of her body parallel to it, chin on her paws. Clara was asleep. Rue was not. Elena stood in the doorway for a long moment. She was a neonatologist. She had trained for 6 years and worked for 8 more. She had managed the care of hundreds of premature infants. She had seen every complication, every variable, every risk factor. She was, by any professional measure, the most qualified person on earth to assess a premature infant at home. She was also a mother who had just brought her first baby home from the NICU, and the professional distance she had maintained for 11 days of clinical care was not available to her in the same way in the hallway of her own house at 6:15 in the morning. She sat down on the floor next to Rue. Rue didn't move. Her eyes stayed on the bassinet. They settled into the routine of the first weeks. Feedings, checks, the sustained alertness of new parents compounded by the specific anxiety of a premature infant at home. The bassinet monitor tracked Clara's respirations and oxygen. Elena tracked everything else with the efficient, dual attention of a professional and a mother. Rue was always there, not always in the room, but always proximate. In the doorway, in the hallway, in the living room with one eye toward the nursery. On the 11th day, Clara's feeding was slower than usual, small, but noticeable to Elena. She weighed her, down 2 ounces from the morning, not alarming with invariance. She noted it. On the 12th morning, Rue would not leave the bassinet, not her usual proximity. Contact. Her body pressed against the base of the bassinet, her chin on the floor, her eyes tracking every visible movement of the blanket-wrapped shape inside it, with the unwavering focus of an animal that had stopped doing anything else. Elena looked at her for 30 seconds. Then she picked up Clara. The baby's color was wrong, not dramatically, not the gray she feared, a flatness in the undertone, a lack of the particular warmth that a week of NICU nursing had calibrated her eye for. She checked her temperature, 97.6, low normal for a neonate. She put her stethoscope on Clara's chest. She called her attending colleague, Dr. Bhaskar Mehrotra, at 7:12 a.m. She described what she was hearing. He said, "Come in." The blood work that morning showed early onset, late neonatal sepsis, a blood infection that in premature infants can escalate from subclinical to critical in a window of hours. Clara was admitted and started on IV antibiotics within 40 minutes of arrival. She spent 6 more days inpatient. She came home again, pink and stable, with a weight gain chart that made the NICU nurses smile. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. Dr. Mehrotra told Elena, on the day of discharge, in premature infants, sepsis can present without classic fever or obvious distress. The chemical signature in the blood, certain volatile compounds produced by bacterial proliferation, are present in exhaled breath before the clinical presentation becomes clear. Dogs have been documented responding to exactly that olfactory profile. Rue's behavior on day 11, the increased proximity, the contact pressing on day 12. That tracks with alert behavior in response to a detected chemical shift. Elena said, she was there from the first morning. He said, yes. She was probably reading a baseline the whole time. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. Santiago brought Rue in with them when they brought Clara home the second time. He set the carrier on the living room floor and let Rue approach it. She moved slowly, the way she had moved on the first day. She lowered her nose toward the blanket. She inhaled once. Then she looked up at Santiago, and her tail moved. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If these stories matter to you, subscribe so you never miss the next one. Clara is 14 months now. She pulls Rue's ears. She falls asleep against her side on the rug. Rue tolerates it with the same unhurried patience she has always had. The next story involves a dog whose behavior in the last week of a pregnancy alarmed everyone in the house and turned out to be the only warning anyone got.